Right. So obviously the chief complaints, inability to digest foods, constant, was the big issue, brain tension, brain fatigue issues, sleep, SIBO. So I wrote this in the summary report. Did you get a chance to read the summary report?
Yes.
Okay, so let me go through it with you to make sure everything makes sense line by line. So the key impression was disruption of the brain gut axis, secondary to traumatic brain injury, and microglial priming. Does that make sense to you? Remember the microglial priming and the brain gut axis disorder?
Yeah.
Okay. Associated with progressive patterns of chronic traumatic encephalopathy, appears to be an underlying cause of gastrointestinal patterns that includes digestive enzyme insufficiency, impaired gastrointestinal motility, recurring patterns of small intestinal bacterial overgrowth, recurring patterns of gastritis, and patterns of dysbiosis. Abdominal auscultation of the abdomen demonstrated reduced bowel movements and faint contractions. So when I was listening to your abdomen, you really couldn't hear much movement or activity there. That's that reference to that.
Right.
There was no pattern of impairment in the palatine muscles, even with repeated contractions of the gag reflex was intact. So I had you go, checking those muscles. And those are vagus muscles, trying to see if they contract. And they were fine. There was no problem there. This pattern suggests some degree of integrity of the cortical pontine pathways that act at the vagus. So usually what that means is like the brain to these muscles are working really well. So that was a finding that we had to consider. The presentation of physiological tremor with significant autonomic change to the basal ganglion and hands and feet is noted with sweating of the limbs in combination with positive Blanch test and observation patterns of pulse circulation in the hands suggests increased sympathetic tone. So sometimes people have a brain gut axis disorder because the brain doesn't fire to their vagus very well. And when we see those brain gut axis pattern that way, is when we have a person do the gag reflex and go, those like punching bag muscles don't move. But with you, they move perfect. They're fantastic. So that means like those connections from there to your vagus that then helps digest your food were intact. But what we didn't like was the fact your sympathetic system was so revved up. And like when I touch your skin and you like see the hand mark there, that's like a blanching test, and your heart rate was up, and your autonomic system was really involved. So then I put in here in the report, there's strong possibility of dysautonomia, meaning there's not a balance between your sympathetic fight or flight and parasympathetic digestion movement, with increased sympathetic tone secondary to injury of the frontal cortex and lack of activation of the pontomedullary reticulospinal. This is a neurology pathway. It just is a pathway that dampens your sympathetic tone. And this is puts you at this. There's increased risk of developing complex regional pain syndrome with injury to the limbs due to unnecessary sympathetic tone. So let me explain what this is saying. You can have a brain gut axis of a couple ways. You can have a brain gut axis because your brain doesn't fire into your vagus nerve, and then like you can't digest. And I don't think that's exactly what's happening to you. So I think you have a brain gut axis disorder because your sympathetic fight or flight response is way too high. And that is going to shut off your parasympathetics.
Yeah.
Okay. So like you're always in the sympathetic mode. So it's hard to digest, to swallow, to make enzymes, to get healthy blood flow to your gut. It's all parasympathetic. So that's more of a dysautonomia instead of like a cortical vagal defect, cortex being brain, vagus the pathway to it. So all this paragraph is really just saying, hey, I think you have a brain gut axis disorder, and all these gut chronic GI symptoms you have probably not related to the gut, and they're probably just related to this increased sympathetic tone, most likely secondary to a brain injury. Okay, that was kind of the summary of this paragraph. That's your medical report. The other thing I put in here is you may be at risk for complex regional pain syndrome. Have you ever heard of that?
No.
This is some people when their sympathetic tone is really, really high and it's impacting their limbs. If they get an injury, like a crush injury, they can get a really bad chronic pain pattern. So you need to like avoid crush injuries on your arm.
Okay.
Don't get injured. We get you out of the sympathetic mode. Okay. So that's a finding.
Avoid. What are you saying?
Don't get your limbs injured. A crush injury is like when you get something that crushes your hand. I was trying to be funny. It was a bad joke.
Oh, okay. So that you're saying, but that would that you're saying that I wouldn't The complex regional pain syndrome, that would be that I
It
would be
increased
like
risk for developing that.
yeah.
So when like when your sympathetics are fired like yours in the arms and the hands and limbs, if you get an injury to your hands or limbs, it could cause a chronic pain pattern.
Okay.
All I put in the report was you're at risk for that.
Yeah, yeah.
I think it's a big deal. It's not just your gut. There's other things that can happen when you're in a sympathetic mode. Okay.
Okay. So it's just it doesn't allow the limbs to heal as easily
Yeah.
as you're saying.
Yeah.
Gotcha.
Right. And it increases pain perception.
Okay.
And then I put Mark reports that he had significant traumatic brain injury in his teens, where he had a significant fall while skateboarding. Clinical history examination suggests that he has suffered typo from a countercoup brain injury resulting injury to his frontal lobe, specifically to the prefrontal regions of the right premotor frontal cortex. So remember, like we thought you had fallen back and hit your head forward, right?
Yeah. Yep.
So that was basically the frontal show. There's significant subjective symptoms associated with prefrontal cortex injury. That was on the brain region localization form. And then when I had you walk, there was like some issues with double tasking when I had you to walk with trying to do every other letter of the alphabet. Mark, that was an issue. Then you had dyspraxia, where I was trying to have you do your finger to thumbs and just kind of be as fast as you can, trying to tag each finger. And that was something we wanted to look for. So I put here, there were clear patterns of dyspraxia. So dyspraxia means your frontal lobe is planning how to do a task. So if I go finger to thumb, finger to thumb, finger to thumb, finger to thumb, that motor planning of how to touch each one in sequence is your frontal premotor area. So that's what we were a little concerned with, because there was patterns of that, especially on the left side of your body, upper and lower. Then also, there were clear patterns of moderate dyspraxia in the entire left side of the body and cortical bulb projections of the tongue and facial muscles. So we had you do repeated blinking, repeated tongue movements. That wasn't as coordinated as well. Okay. So any questions on that part of the report?
No, I mean, yeah, all that makes sense.
Now, on the laboratory, on the blood test, so then I had you to order a blood test, and I wanted to see if your blood-brain barrier was breached. So we measured a marker called S100B, and I wanted to get a general marker for any underlying factors that can increase your brain inflammation, just as a screen to make sure nothing's going to get in the way as we move ahead and start putting together a protocol. Okay.
Right.
And they wanted to see if you had any neurological autoantibodies. And then didn't recommend any imaging studies at the time. Then the recommendation, we'll talk about how far you got along with it, but it sounds like you got into ketosis from the emails you sent me that I'll pull up here in a sec. A ketogenic diet was recommended with time-restricted feeding that included 18 hours, 6 hours of feeding window. And then to have you measure ketones, which it looks like you did, right? Did you able to do the intermittent fasting? Were you able to do that?
I am still working on getting the intermittent fasting. I can go into all that. I've just had like trouble getting food down, and so I'll miss a meal, and then it'll end up being a little later. So, not sure that I'm fully in ketosis. I guess my highest was around 0.7 millimoles, and so I'm still kind of working on that.
You did a great job documenting that. Yeah. Mark was asked to continue supplements he felt were helping his digestive function, and then consider adding MCT oil while transitioning into ketosis. Did you try that?
Yeah, I have the C8 oil that I've been using. So that, and then I also had the BHB.
Okay. And then neurological exercises, we just had you do some complex movements of the alphabet, just, because to get that motor frontal lobe to work more. Double tasking, so complex movements of alphabets with the left arm, left leg, and left hand. To get that right motor cortex, you're doing on the left, concentrated activities of learning new songs while playing the guitar, since it's your position. Exercise to activate the prefrontal cortex, double tasking while performing mathematical calculation and cognitive tasks. Have you had a chance to do these?
No, not fully.
Fully.
I can go into more detail. I think I need a little more structure. I need to have more of a schedule or something. so that I know exactly what I need to do and for how long and how many times a day. So I think I've been just trying to focus on getting into ketosis, and then weaning off of the cannabis also has been, I've been doing that. And so I've been kind of like, okay, one step at a time, and then having more of a clear sort of instruction on this in terms of timing and duration.
Yeah, we'll do that. We'll finish off with like a plan and stuff to focus on before we get done here. Okay. And then let's get into here, goals of management. So the goals of clinical management are start with strategies to reduce neuroinflammation, which you've been doing already, and microglial priming. So those are the overactive immune cells that get turned on when you get an injury to the brain. These initial strategies include a ketogenic diet to increase ketosis and intermittent fasting to promote autophagy. So the difference between the two, Mark, is that ketosis is anti-inflammatory, but intermittent fasting will promote something called autophagy, where you can get rid of those injured cells. That's really the really most effective known pathway. There's not actually many other things that we know about that does that, but intermittent fasting turns on these genes that then get rid of these debris cells. So that's the big picture. We'll get to those stages as you can get there at your pace. There's no rush. It's just whatever you can do. So the goals of initial management is ketogenic diet, which you've started. Intermittent fasting, we need to give you more direction with. And then the neurological exercises, we got to develop a plan to make sure it's clear and how often to do them and everything. And then number 4 was evaluation for mechanisms involved with microglial priming, such as blood-brain barrier permeability by evaluating S100B levels and potential TBI-induced neurological autoimmunity. And those are all fine. The S100B antibodies levels are normal. Let's look at the neurological antibodies. And then I said Mark was asked to send weekly emails. Measure of serum ketones to determine the achievement of ketosis. Update on intermittent fasting, which I'll go over your emails. Report on the frequency of neurological exercises throughout the week. Evaluation of brain endurance throughout the day. Evaluation of hours of sleep required, up at her, to function normally. Any symptoms of brain fatigue associated with development of anxiety. Any changes in general gastrointestinal that include patterns of digestive enzyme insufficiency, intestinal motility, bowel movements, patterns of bloating, and distension. Okay. This is the email I got. You only sent me one, right? With the summary of all of them?
Yeah, and there should be other notes as well.
Yeah, I got the other notes, but so this is like this. Let's start with this email. This is like he started ketosis on 11/21. So probably it's been a month, not a month, 3 weeks.
Yeah.
3 weeks. So you measured your ketones. So right off the bat, your ketones are 1.3. Wow. So you were in ketosis.
I don't know what that was about because I never was able to achieve that after that.
Okay. Now your ketones, so you actually are in physiological ketosis. Okay. Anything above 0 is ketosis.
Oh, okay.
A lot of like sports.
I thought I was the 1 to 3 range. I thought that
a lot of sports ketone people like to say 1, but as long as you're making some ketones, you're in ketosis. Okay. And you could be in better ketosis than this, but you're in ketosis. Okay. Now if you took some like a MCT oil,
yeah,
right, like an hour before your measurements, you would easily be in 1.
Okay.
And one of the things with being in ketosis is sometimes you want to increase your ketones because your ketones are anti-inflammatory. So what we want to do is we want to start healing that frontal lobe and changing your brain and improving that brain gut access. And one of the most powerful ways to do that is to get ketones to help block that inflammation. So you physiologically have figured out how to cut your calories and increase your fat in your diet to be in ketosis. You are in physiological ketosis. You are measuring ketones whenever you're measuring them. Even though they're not above 1, they're still ketones.
Okay.
And it's consistent. So you are in ketosis. You're not making a lot of ketones, which means we're not getting as much benefit from it. And that partly is because you need to increase your fats. So the more fats you can take while you're in ketosis, the more ketones you make, the more anti-inflammatory effects you get with the brain. So like right now, what's your like diet that got you into ketosis?
Um, Mostly, yeah, like focused around eggs, avocados, greens, zucchini, bison, cauliflower, rice.
No, like right, Mark, tell me like a timeline from when you first wake up and go throughout the day. Like,
Oh, like if like what my first meal is like,
yeah.
or well, I'll start with the collagen, um, like C8 coffee. So I'll add the fat and the protein of the coffee, and then I'll hang on that for an hour or so.
And what time is that? So what time do you wake up and when do you have the coffee?
I'll wake up. I'm a slow riser. Probably around 10,
Okay.
and then I'll have a bunch of water, and then I will have my coffee with the collagen and fats in it. So
Okay.
that's probably around 11 a.m. to 12. Sometimes
Okay.
I don't eat my first meal until 1 or 2.
Okay. So you're already doing intermittent fasting. So,
However, I've also noticed that if I do stay on the caffeine, if I'm caffeinated without much grounding in terms of getting foods in, it can give me the illusion that I have the energy, and then once I'm get my first meal and I'm in some stressed mode where I'm like, oh man, I should have eaten a little while ago. I feel like I'm pushing my adrenals or something. So I've noticed that, and then it'll kind of whack me off. Like the rest of the day, I'll feel a little bit out. So I'm trying to make sure I don't push that for too long. Um,
yeah, you should definitely listen
yeah.
to your body. I mean, if you feel like you're pushing it way too hard, you can back off for sure. So after you have the meal, like you have the coffee, and then you may not eat till 1 or 2. When you actually do eat, what are you eating?
Yeah, like an avocado, an egg, some greens.
Avocado.
Um, I have these keto birch bender waffles,
Okay.
um, with what I'll put butter and nut butter on, and yeah, or a salad with some chicken on top, and then yeah, that'll be mainly like one of those will be the breakfast.
And then how much avocado are you having?
It's either a half or sometimes with these little ones I'll have a whole one.
Okay. Right. So that could be anywhere between 12 and 2.
Yeah, yeah,
When the next time you eat after that?
probably around 4 to 5.
Okay.
Sometimes I can only manage it, especially at the beginning of this, feeling like just not so totally satiated and not like actually wanting to eat because I was nauseous.
Yeah.
But I think I'm coming out of that a little bit just with the changeover of foods and the gastrointestinal symptoms have subsided a bit. So it depends. Like I remember on Thanksgiving, like I had this big meal in front of me, and I was just like, oh, I guess I could eat. Like I don't need to eat. I haven't eaten all day, but I guess I could eat Thanksgiving dinner. Um, so probably around 4 to 6 would be my next meal, and that might be like veggie kind of stir fry with cauliflower rice and some bison. Um, yeah, you know
And that's 4 to 6.
have like yeah
So Mark,
these.
what about
Sorry,
you?
go ahead.
I thought you were go ahead.
I was just gonna
Sorry.
say, like transitioning along, I would have maybe an almond flour wrap, um, like a tortilla that I would toast. But I've been like trying to have minimal um, carbohydrates in general.
Okay.
Um, yeah, which also goes to my question, which we can go over. But it was just like, should I be fully, like not doing any carbs at all, or should I have some blueberries now and then and having a little bit of this here and there, or
Okay.
any keto cycling, or just are we going to full on right now?
So do you have anything after 4 to 6?
Yeah, I'll probably have another meal later.
Similar to the one before?
Yeah, it might yes be something like lunch. Um,
Avocados, eggs, keto waffle, veggies, green.
yeah, well that was breakfast, so I would have something,
Oh,
or maybe some lox over a salad with some cauliflower rice or some vegetables.
okay.
Um, and then yeah, I guess for a while I had I'll probably make more of it, but I had a like a keto vegan cheesecake that I made.
Oh, nice. So
Um,
you're becoming the chef?
yeah, I used to make these, and I just figured out how to make it keto as well with the Lakanto monk fruit. So that's just like a fat bomb right there, um,
Nice. That's awesome.
and it's very filling. So I think just having that around is keeps me satiated.
Yeah. Okay. And then do you have anything after 6 to 8? Or that's it for you?
For the most part, yeah, that's usually it. If I'm having like cravings or anything, I would have maybe a slice of that cheesecake at night, or like some dark chocolate with some nut butter, or maybe just a spoonful of ghee, or um, yeah, but nothing like large after that. Just small snacking.
All right, so let's go over
So
that. Let's go over that first, okay? Let's go over for sure you're in ketosis. So let's go look at your chief complaints just with being in ketosis. Was there any change in your digestion by being in ketosis?
yeah, at first it was a lot of gas, a lot of changing bowel movements. I think that I've hit a normal. I'm back to normal now. Um, Although sometimes when I do take the C8 oil, my stomach gets a little bothered by that. Um,
The C8 is a coconut oil.
yeah, it's the caprylic acid, like just the C8, like the yeah, it's basically caprylic acid.
Okay.
Um, but it's like a subset of MCT.
It's a powder or is it a it's a powder you take?
It's a it is a oil. It's a oil liquid.
Liquid oil. Okay.
Yeah, it's supposed to be the oil that gets you in, like has the highest ketone content. And the reason I haven't been taking MCT is it can lead to more digestive distress. Um,
Okay.
but you know,
Have you
if you
tried
have,
have you experimented with them or you just you
I
only
have in the
experiment?
past, yeah, but I would get like disaster pants, you know, taking the MCT.
Really? Okay.
So I find that the C8 gets you more ketones, and then it's not as hard on the digestive tract.
Okay. And
Um,
how many once your the gut started to get used to it, how many days was that?
that was recent. I would say it took about 2 weeks to really adjust digestively, and I was just super low energy, and you know, I definitely went through the keto flu
Yeah.
phase. I feel like I've moved through that for the most part. And I did have one night where my housemate had the keto salts, like the BHB, and I was just so sluggish. And said, I think my housemate has these salts that can help you kind of get over. So
Yeah.
I tried them, and it was like, oh, you know, like my mind cleared. Everything felt, oh, I was super aware, and like, so I kind of got a glimpse into what that can feel like.
Nice.
And so I ordered some of that for myself. I know that you had said something like don't go too crazy on those, so I don't use it all the time. Um,
No, I think what I was trying to emphasize was when you're actually trying to measure yourself getting into ketosis, if you take them, that'll throw you
oh
off.
yeah, okay. So for measuring
Or,
purposes,
yeah, just for measuring purposes. Okay. So you can use them as much as you feel like your brain needs them. As a matter of fact, if you're in ketosis and you use them, you're going to get a greater anti-inflammatory effect on your brain. So we're all for it now, but we just didn't want
okay.
to make sure you knew how to cut your carbs down enough so you can get into ketosis. Okay, and then after the 2 week period of getting through keto flu and adjusting your gut, and it's probably been like a week where you've been able to be stable at this point. Have you noticed any changes in your gastrointestinal symptoms besides that transition?
Yeah, they've improved. I haven't had the gas. I have been more more so back to normal.
Okay.
I think I've adjusted to it. But yeah, I was definitely off at first, and but nothing. Yeah, not any huge complaints right now.
Well, let me be more specific. Your chief complaint was inability to digest foods and resolution of bloating, gut pain, and fullness. Or any of those symptoms changed?
Yeah. So
Because
I think I've throughout like the 3 weeks, I may have filled that out during more of that time, and then this week has been a bit better. Um, so I always usually have that stomach fullness,
Yeah.
and so I'll take an extra HCl or some protease or whatever I need, So I'm popping a lot of digestive enzymes and HCl to get this stuff down, because it is heavier in general. Like I'm not consuming any carbs, which usually break down pretty easily. So I'm having to increase my digestive aids.
Yeah.
But without that, it would be considerably worse. Like I would have a lot of gut, But without that component, like I've been able to manage it, and I'd say number one isn't as on the table right now.
Okay. Do you take any lipase when you increase your fats?
I just ordered some, and I've been taking it. So I've been using that.
Perfect. Okay. Now, since you've been in ketosis, any changes in your brain tension, fatigability, irritability, mood swings, sensitivity?
Um, so the variable of like slowing down on weed too, I feel like creates an entourage effect where I can't fully know what's doing what.
Right.
But I can delineate that the lack of any sort of hypoglycemia or hangriness. It's like I'm sitting in front of my Thanksgiving dinner, like I could eat, I couldn't eat, like it doesn't matter. Where I used to have a lot more issues, like needing to eat every few hours. So the whole like blood sugar effect, and not feeling like irritable, like I need to eat right now, that's definitely noticeable. Um, there's definitely more of like a calmness, but I wouldn't say that like the sort of tension, so to speak, is eliminated.
How about your brain endurance?
No, I haven't had an improvement on that. I've sort of hit a level of anhedonia,
Okay.
um, and I've noticed, yeah, I've just been having trouble without the weed, um, and so I had to have a little bit,
Yeah.
because I was just like super out of it, and I was actually yeah, like these are on my notes. I can go into that later, but just curious about how I can work with that, knowing that I'm not getting that sort of stimulation anymore. Um, I sort of feel dull and sort of flat and uninterested, lack of motivation. So to me, it points to dopamine,
Yep.
and but we can talk about that. But yeah, that's definitely like an issue in terms of compliance. I need to like address how I'm gonna be able to get through that.
Okay. We'll make a note for that. All right. So let's go. So here's a couple. Let's talk about your diet and then move on for a few things.
Okay.
The number one thing right now is you're in ketosis. You figured out how to cut down your carbs, but you're not getting enough ketones. Like we need to get your ketones way up because we want to really get an anti-inflammatory effect. Plus, we want to give you energy. So, a couple things you need to know, like where you are right now. So, first of all, you can get into hypoketonemia, meaning low ketones in your blood. Okay? Just because you're in ketosis doesn't mean you always have enough ketones to supply the fuel you need for your brain. Just like you can get hypoglycemic low blood sugar, you can get low ketones too. Okay. So you accomplished the job of cutting down the insulin driving pathways that get you out of ketosis and get you into ketosis, but you don't have as much ketones as we want. So if the caprylic acid source you're using is not working for you, or it's too hard for you to digest, but then we got to do it with food. Or if that is working for you, we just need you to take more. And if you take more, you may be able to tolerate it once your lipase enzymes come in. But in any case, we got to get fats up. Okay.
Okay.
So one of the like goals between now and the next time we connect again is we got to get you're in ketosis. You figured out how to do it for your body, but we got to get your ketones up by increasing your fat, healthy fat.
And what would be a good like range in terms of millimoles that we're looking
If you
for?
can get it if you can get it in the above one range, that would be a really good place to be.
Okay.
1 to 3, but you're in ketosis. The problem is like if you didn't think you were in ketosis right now and you got frustrated because you're like, I'm not sure what else to cut out. I'm not eating any more carbs. Like I'm not getting there. You would feel like you never were able to accomplish it. You were able to accomplish it. You just need to have more fat to make more ketones.
Yeah.
So, and then you can also, when your blood sugar, like when your brain function goes down, you can take exogenous ketones. Okay. Just know that the readings you get are going to be influenced by the exogenous ketones. At this point, we don't care because we know you figured out how to cut down your carbs enough to get in ketosis. You'll even see taking either the acrylic acid derivative you're taking for MCT,
Yeah.
or just actually taking ketones, raise your levels, and that's fine with all of us as long as you don't start adding more carbs in. If you keep your dietary levels of carbs to the point you're still in this ketosis, use exogenous ketones and use more healthy fats. You can also like have more olive oil and things like that in your diet. Like when you look at your meals, you're not getting much fat. You're not getting enough. You cut down your carbs, but you're not getting much fat. So we're down here. Okay, let's take your breakfast for example.
Well, I'll like pour the C8 oil over my stir fry once it's done, or like put the ghee on it or the butter on the waffles or
Oh, you were doing that?
oil.
Okay, that was it.
So yeah, I didn't mention that.
Okay, well that'll work.
Things like that, and then getting, I could always go for an extra avocado or something.
Yeah, you
Um,
can go for an extra avocado or some extra fat to whatever you're already doing that can help get your ketones up more.
I'm going to need to take more like enzymes in general. I
Yeah,
think if I'm going to eat more like that.
then do
Um,
what you gotta do. I think the lipase was the most specific one to help you for that.
okay.
When that comes in and you take that, that should be really helpful for you. Okay.
Okay.
So that's like the first part. It's just to get your ketones up, get your inflammation down, and it sounds like you're already doing intermittent fasting. So you don't have to do intermittent fasting every single day. Like you're saying, some days where you just feel like you'd have something because your energy is really low at night, you can eat something. Ideally, if you're in a persistent, consistent long-term fasting phase, you promote more autophagy.
Yeah.
So you got to get to that. Anything past 14 hours starts to turn those genes on. So when you're eating and finishing by 8 and not eating till 2, you're for sure turning on your autophagy genes. And if it's not that long and one night you eat it, you start eating at 1 or you go to 9, and then that's okay too, because you're still in that therapeutic window.
Okay.
So
Part of me
that's,
wonders because my digestion's so slow that it has such reserves of all the food that hasn't been digested, and if I'm actually fasting,
well, then you're
you
actually,
know.
no, you're going to be digest things. You're going to give your gut a break to digest those foods. They need it.
Well, that's what I mean. Like if I have a big meal and like by 6 o'clock I'm like super full, you know. By 9 maybe I'm still digesting it. Like
I get you.
is that actually me fasting yet, or like I just my thing of like me digesting so slowly that I wonder if I'm actually getting that autophagy effect until like 4 hours after I've eaten or something.
I think you are. I think,
Okay.
yeah. Okay.
Okay. Well,
So
that's
let's
just an idea.
so let's go over some of the questions that were in there for the follow up. You want to go over this first, or do you want to go over your questions, or are these your questions?
I think we've gone over most of that, right? Your questions. I
Yeah.
guess we can go over the neurological exercises. Or we can do my questions first.
Yeah. Let's go over your blood test, and then let's get to your questions and kind of get the big picture. So by the way, your blood test was pretty good. Your glucose is fine. So that's a marker for blood sugar stability. You don't have any patterns for diabetes. Your kidney, liver functions are all fine. Your phosphorus is just zero point 0.1 off the lab range. It doesn't mean anything. So on this first page, we're just really looking for biomarkers that are associated with like a metabolic disease, some kind of liver disease, kidney disease. You don't have any of those things. So you're healthy in that way. The last part of the report here, they were looking at your iron markers to make sure you weren't iron deficient. Your iron levels were totally fine. Your glucose levels were good. We actually, I'm sorry, it's repeated the same page. Your fibrinogen levels is a marker for clots, blood clots. Those were within normal limits, totally healthy and fine. And then your white blood cells were checked and your red blood cells were checked and broken down to different patterns. And this is a test to screen for anemia, and you didn't have any patterns of anemia. And your MCV, MCH, MCHC, they're all within the normal reference range. Your urinalysis was fine. Nothing was abnormal there. S100B protein is a marker for neuroinflammation and not just neuroinflammation, but blood-brain barrier breakdown. And your markers were okay there. So your blood test really shows there's no indications of anything getting in the way of you responding with anything there. You have a question?
Also, we had a environmental mold test done in my space, and it also came back negative.
Oh, you did? Okay, fantastic.
So I was curious if I had any mold in my room, but that's not the case.
You didn't have any? Okay. Can you send me that when you get a chance? I like to keep it. Wow. Okay. And then let me see here. Did you get a chance to do the Cyrex Array 7?
We're waiting on the results, yes.
Okay. So when those get back, that's the next thing we want to figure out what's happening. We want to see if not only do you have neuroinflammation, but has the neuroinflammation been so severe that you have neurological autoimmunity. Okay. So anytime someone has traumatic brain injury or we feel significant inflammation causing a lot of their symptoms, we always want to rule out neurological autoimmunity. So that Array 7 panel is going to look for antibodies to like proteins in your brain, like myelin basic protein, neurofilament. And if you have them, it just means we have to add in an autoimmune approach to manage your case. And if you don't have them, then we're just focused on the neuroinflammation part of it. Okay.
Okay.
And this is just every time we do a follow-up once a month, I'll just have you fill out these forms again. And these are still pretty consistent with your past symptoms. So there hasn't been any major change in your frontal lobe symptoms yet. There hasn't been objectively when we look at your past form and this form in the past month. Okay. But it's going to take a little time, so we'll get there eventually. So that's really no difference in your brain region localization form and no real difference in your other forms yet. So we're just in that still getting you in ketosis and getting you into autophagy state of your care, right?
Right.
So let's go over here and let's go over the goals. So ketogenic diet, you've gotten the hang up. We just need to get more ketosis and have that take its effect on you for the next month or so. Intermittent fasting, you are doing. We need to get some better planning for the organization and how often you do the brain cortex exercise, and you don't have any blood-brain barrier permeability. Okay.
Okay.
This area here more because I need some feedback with you to figure out what's going on. So if you can just send me
one of those.
Yeah, but I need them a little more often. Okay.
Okay. I guess it took me a while to get everything started.
No problem. We just want to track because this is the process where we're going to work through figuring things out and know what your energy levels are, and just keeping a like a journal of these things throughout the month can really help us to see if we're totally off track or if we're on track or not. Okay. Now, let's just go through them together just to make sure. So we answered a lot of them already. So measure of serum ketones, determine achievement ketosis. You were able to do that. We were confirmed you were in ketosis. Update on intermittent fasting. You actually have been doing intermittent fasting. So that's fine. Report on the frequency of neurological exercise. So this is something you really haven't done. Evaluation of brain endurance throughout the day. Has your brain endurance changed at all since you've been in ketosis?
I wouldn't say anything noticeable yet.
Okay. Evaluation of hours of sleep required to function normally.
No changes there, although I did notice that I took 5-HT. I would take 5-HTP before bed, and sometimes that would be a game changer for me in terms of getting deeper states, and I'd wake up feeling like, wow, I haven't gotten rest like this in so long, and then I'll take it, and then I guess I got used to it, and then I'm like, if I don't take it, then I won't sleep. But I recently took it out, and I've actually been getting better rest and waking up without feeling super groggy.
Oh,
So I'm kind of like, okay, maybe I'll keep it out for now. I notice when I take glutathione or melatonin, that makes me pretty groggy. So I think it's really about magnesium always helps, and I've been taking a little CBD, like the tinctures. I don't know if I've just been kind of using that. Um, and then I'll take a magnesium bath before bed whenever I really need to get a good night's rest, and that usually knocks me out. So, just a note on that, like the 5-HTP I took out, and I've noticed like I get good sleep without it, and I don't wake up as groggy. So maybe that was doing something to like my neurochemistry.
yeah, I think to also be careful of, be aware of, Mark, is when you start try to take some, you might even want to take some exogenous ketones right before bedtime.
Try taking them before bed.
Yeah,
Okay.
because again, sometimes you get into a low ketone state when you're sleeping.
Okay.
So just take a couple before bedtime, a couple capsules, and then digestive stuff we already talked about. So what are your questions? And by the way, just kind of recap where we are with the big picture. Where we are with the big picture is you're in the first two stages of this. You're done a good job with, and we just need to get your ketone levels higher, so you have a
Okay.
greater effect from ketosis. The third part is going to be critical because that's going to be the game changer. Game changer is once your brain is in an anti-inflammatory state and has fuel, we got to get that frontal lobe to work. So we'll talk about that before we finish. But what I want to do is go into your questions you have.
Okay. Um, I have noticed that tinnitus, a bit of ringing that comes in, like stronger than usual, and I was looking into that and related to keto, and um, so I was wondering if you had any like notes on that. Is saying something when your brain or your brain or your ears, they don't have a reserve of glucose, and when that's super low, you can get those sort of ear ringing symptoms. So I don't know if that's indicative of anything, or if I should be paying attention to that, or if I should do something when that happens, or
How long has this continuously happened, or just when you were going that keto transition phase?
it still happens. Like yeah, and it'll be like 2 or 3 minutes of like a very strong, prominent ringing sound.
Let me
So
check.
my only kind of investigation was, you know, that you can't really feel when your brain doesn't have or your the non-reserves of glucose, and that's one of the ways that it like tells you that it doesn't have enough glucose. So I don't know. I'm like, is this bad or is this just something that happens?
So when you feel like when you have tinnitus, however you want to pronounce it, tinnitus is basically neurons that are firing spontaneously on their own, right? So this is what they call in neurology epileptiform activity. It's like a seizure, spontaneous firing on their own because you're sensing a sound that's not really there. So this neuron itself that's firing. And then those can happen when there's like injury to the auditory nerve for people who have been around really loud music for a long period of time. They get injury to those little inner bones that are receptors, and they start to fuse together, and then the nerve starts to degenerate. Or you can get it if your temporal lobe is injured. So I pulled out your recent brain region localization form. We're just looking at your temporal lobe because your temporal lobe is your auditory cortex. So if your auditory cortex is injured, then it doesn't have as much mitochondria and it gets less energy produced inside the neuron. And then those neurons get like closer to reactivity and they can spontaneously fire. So, you don't have a lot of symptoms here to be worried about that. Do you have any issues with auditory sound hearing? Like I know you're a musician. Have you been around like loudspeakers and um, any kind of injury to
Yeah, a lot in my
auditory
past.
pathways? Yeah, it's possible you have some little inner ear auditory pathway damage if you've been around a lot of noise for many years, and as you're getting your fuel to your brain change, it's expressing more. Um, but it's all theory, at this point. We don't know. We just have to keep an eye on it. It's not indicative of anything other than you have another pathway that's involved besides your frontal lobe.
Okay, yeah, I just thought I'd let you know about that. It's usually my right ear,
Okay.
and that's usually the one that would already had pre-existing tinnitus. So yeah, my other question. Well, yeah, I was kind of like looking at we're talking about the sort of sympathetic dominance. I'm wondering, as we do bring the cannabis out, like it can only do one thing at a time, but I'm curious if like doing the caffeine is also stimulating the sympathetic mode, and how problematic, like if I'm stuck in that, is that helping or hindering that, I don't
Um,
have excessive amounts. I usually have 1 to 2 tablespoons of caffeine, like 1 cup, like
yeah.
12 or 16 ounce every day.
I think you need it right now to get you into ketosis, get you to transition, and it's not too much. So I'm not worried about it right now. No.
Okay. Um, yeah, and I guess that relates to the anhedonia feeling, feeling a bit flat, a bit dull. I'm eliminating the fix from the cannabis, but I'm also not getting carbohydrate fixes, um, in terms of like a dopamine or stimulatory release. Um, when I uh, took space from cannabis and caffeine like for 10 months a few years ago, I was able to get to the gym. Right now I can't go to the gym, because I'm unvaccinated and they don't accept that, so I'm not able to get physical exercise, which I think would be really good for that. um, and I think that really helped me push through the anhedonia last time. So I'm sort of like in this phase of, um, yeah, I just feel a little bit dull and uninterested, and I actually, kind of like submitting to some like computer scrolling, or like I've noticed like I just don't have any energy to like want to do any of these. I'm not inspired to do anything, um, at points, and I end up just like watching YouTube videos, or just kind of glazing over and just like, all right, I've lost my motivation. Now I'm watching random videos.
Well, Mark, you're definitely in a low dopamine state. Okay, so that is going to cause your symptoms of being flat. And the best way to raise dopamine is through physical activity. The best way to get your frontal lobe to raise dopamine levels and epinephrine, norepinephrine for your frontal lobe itself specifically, to help you with focus, attention, concentration, all those things, drive, is physical movement.
Mm-hmm.
The gym hasn't doesn't have to be what defines physical movement for you. Like you got to get physical movement in. The key thing is sometimes you can't do getting into ketosis and exercise at the same time because it's too much for someone. Like the body really has a keto flu and some problems when they try to do that. But now that your ketones, you're in ketosis and established, you figured out your diet, and it could be a good time for you to increase your physical activity other than going to the gym. Are there other things you like to do that you can do? Like, can you go for a jog or run, or what are some things you like to do?
I like to rock climb, and that's super
Right.
not as accessible.
Yeah.
Um, I walk around my neighborhood. We've got some kettlebells at home. I think it's just something about the gym that just motivates me, and it's hard to get me to do my home exercises, especially after a year
It's
in
hard to do
quarantine. And just, but I can figure it out.
that.
I'm,
The thing with dopamine is like the hardest part is to get past that hump. Is once you make it, then everything's easier. So like
uh-huh.
the first few workouts are the hardest ones. Actually, the first two, and then because your dopamine levels are so low, it's like you have to have everything you can and every will you have to
Yeah.
get you there. And then like the next one is there. Now your dopamine levels are high, and now it's easier and easier.
Yeah.
So it's going to always be when your dopamine levels are low. The first couple really using your will to get you there, then your dopamine levels start to mix back up, and you start to go and function well. You have to, that if there's no more effective and better way to get your brain dopamine levels and to break out of this mode without physical exercise. There's no other way. You can try to take supplements with like dopamine precursors. They're not going to give you enough support as you need right now.
Yeah, I guess also connected with that, when I do take tyrosine, I feel cracked out and like I had this
Yeah.
head tension.
No, no.
Um, and you were saying something about like there being, um, I'm pretty sure in sort of our takeaway from our first meet that there was a dopamine sort of like hanging out in the synapse, and like I had too much dopamine, and now I'm like I think I don't have enough. So I'm trying to understand what is going on, because if I don't have enough dopamine, but then when I take tyrosine, then I end up getting, I feel really high strung and tense. I'm just like, well, why?
So first of all, I'm not sure about what's happening in your synaptic cleft. That's all. I'm not sure where that communication came from us understanding each other. But at the end of the day, like tyrosine is also a precursor for epinephrine too, and norepinephrine. It's actually more likely to go into epinephrine, norepinephrine, which raises your catecholamines, which makes you like more alert than anything else. So really, what raises like L-tyrosine is different than just tyrosine, but phenylalanine, mecanoprines, those are the things that really help with dopamine activity. But whenever we're trying to raise epinephrine, norepinephrine, that's when we use L-tyrosine. Yeah. So I would just say, just can you get to the point where you do some physical activity?
Yeah.
Okay. So let's make the goal like figure out a way to get past the low dopamine stage and get some physical activity. And without doubt, once you get past a couple of those, your dopamine levels are going to go up. But remember, the focus right now is to get your brain to turn on and get that brain information down. The focus until now has always been on your GI. We're switching things around. We can't get your brain to heal. We can't get your frontal lobe to work without activating it. If your dopamine levels are low right now, like you can't do anything. You're not going to be able to recover. And actually, there's a low dopamine syndrome patient that I refer to all the time, which is a person who knows everything that needs to be done that just can't initiate and do it. And typically, if they don't have someone pushing them, it makes it much harder. The good news is, I think you can do it. And if you just get past the first couple hurdles, that'll immediately raise your brain dopamine levels right away. And maybe going off the THC source is impacting your neurotransmitter regulation a little bit too, because that has an impact on dopamine, and you really need to get that up. And that might be the only way to get out of this like slump you're in. And there's no way around it. So once you get through that, so that'll be like the first two things. And then going back to your neurological exercises, like playing with the guitar, doing those focused motor movements. Can you do those or not? Can you do those like?
Yeah, I can do them. I think it was the same sort of thing, like having more of a clear instruction, because I am unmotivated biochemically, and it's like, okay, well, how can I? If it says like do this for 5 minutes twice a day, or like if I just have some like kind of, but if it's too open, then I'm like, how long do I do this for, and how consistent, and is this working?
Okay, so let's make it really specific.
Okay.
Let's go through the plan from this point on. Okay, so plan number one, you're going to increase your fats and ketones, so you start to get above 1. Your levels going above 1 is no longer related to your dietary elimination of carbs. It's all about how much fat and precursor healthy fats you get in. Okay, so you're going to look at your ketone measurements and know that that's the factor now, increasing the fats in your diet, or even having to take exogenous ketones when you're low. And you're also going to take exogenous ketones before bedtime, because we really want you to get into deep, restful sleep for brain recovery. Okay, so step 1 is to increase your ketones with diet and exogenous. And then again, lipase will help you as you increase fats into your diet as a supplement. And then the next part of this is we want you to do physical activity, like every single day, physical activity for, let's say, 30 minutes. You want to go longer? Perfect, but try to get 30 minutes in. And make sure you change your physical activity around, so like you don't do the same thing every day and then your legs are so sore.
Yeah.
Just like
I see over 2019, I had a very rigorous. I was in the gym 20 hours a week. I was climbing, I was doing resistance training, I was in the sauna. Like that got me out of my vices, and that became my new drug. And Perfect. So like the equivalent of how accessible and motivating it is to be around other people doing that, and the camaraderie, it's a lot different being at home and not being able to climb. But I'm able to figure it out. I'll find something. We have weights at home, and I do like curls, and I walk around the block, and So I'll increase it. It's just different from having such an accessible situation with gym.
Okay. And you may want to look into more gyms. Have you looked at all the gym options? Like, there's nothing around, or because some are more open to
I'll have to call around.
all around. Yeah. You just might be used to the gym you're going to, and they have a policy that isn't working for you. But anyways, figure out a way to get 30 minutes of activity in every single day. Okay. And number three, we're going to go over the neurological exercises. So complex moves of the alphabet with your left arm, left leg, and left hand. I want you to do every time after you're at home, right? So you're working at home and doing things at home. Every time you pee, do the set of exercise for 2 minutes.
So you're talking about the writing.
Yeah, sometimes the complex movements of the alphabet with the left arm and the left leg, right? So just put your timer on for 2 minutes and go through the alphabet.
So I'm only doing my left side?
Complex with the alphabet, left arm, left leg. Yep, only left side.
So it's just those, and then we have.
So that's one of them, right? That's the one. So you're going to do complex movements with your left arm and left leg for 2 minutes every time after you urinate. How many times do you pee a day?
Oh man, I don't know.
Okay.
It's definitely been more because I feel like this transition has made me.
Ketones will make you have that. Yeah. So it'll be perfect. So you get at least a dozen in a day, maybe less, maybe more, but it'll be good. Okay.
What does that mean though? Like left arm, left leg, no left tongue, or
so
left
just
cheek?
with cursive, just do some complex movements. So with my arm, I'm doing this. With my leg, I'll do it for you. Just kind of.
And then this is for how long? Like, am I writing a paragraph or just two?
Yeah. Yeah, there's no rules on that, but if you want to make some, just say go through the alphabet A through Z with your arm, go through the alphabet A to Z with your leg, go through the alphabet A to Z. Just with your hand, like your little hand, your big hand, your leg, your ankle, A through Z.
Okay.
Cursive. And then I don't know how often you play your guitar, but how often you play guitar?
I've been playing more lately.
Okay. But try to spend at least a portion of that time creating new songs. Because when you create new songs, you're activating your motor planning areas. When you're playing songs you already know, you're no longer activating your motor planning areas because it's already wired that way. So development of new songs would be great to do each session. How long you do it is totally up to you.
Okay.
And then also right after you do your arm movements, like after you urinate, walk around for also for 1 minute, and start doing math. Every other letter, like do the counting back by sevens, counting back by 23 from 1,000. You start with 100 by sevens, and then you can go like from 1,000, count back by double-digit numbers. Doesn't matter if you get them right. All that matters is you move and walk as you're trying to do math. Those are to activate the frontal lobe. And if you miss one session, it's not the end of the world. Like I just don't feel like doing it right now.
Yeah.
Okay, but as long as you get like 6, 7, 8, 10, 12 of those in a day, you'll be way ahead of the game and you'll be doing well. So the plan is get your ketones up, find a way to get that 30 minutes physical activity, and then do these exercises every time after you pee. And that's the plan for the next month.
Okay.
And then
can I make stuff up, like if I'm learning like how to mentally do square roots or things like that, if I do that while I'm walking? Okay.
Any cognitive task you want. Easiest one is just counting backwards.
Okay.
So then also, here's the other thing to finish off with here. Send me an email each week with this list I gave you.
Right. Okay. I got to make a calendar appointment for that so that I remember to do it.
Perfect. Every Monday, every Friday, or something like that. I'm not going to respond to the emails. I'll just keep them in a library for us. So when we talk each month, I can pull them up and then we can go through it. If I see something that's like really like a big issue, I'll email you back. But we're just going to keep that as a journal. So I have it. So when I do a follow up with you, I don't have to ask for it. I can pull it all up and you're ready.
Okay.
Okay. Any other questions for me?
Yeah. We've sort of covered this in multiple areas, but maybe you might have some other ideas. But there's this kind of sense of like, as I mentioned, like we've named that this brain endurance is an issue, and I'm sort of feeling it when I'm in conversation, whether it's decision fatigue, making decisions, in like a sort of more of like a deeper conversation or debate, and proving my point. I'm feeling like a lack of brain power, like interest, and just kind of feel like I just can't keep up with this, and it makes me feel kind of silly and like I lose my train of thought. So it's kind of like this lack of brain power, I guess, and we've seen that like in multiple different ways of describing that. But I'm wondering if you have any comment on that and how I can, like better improve that aside from the stuff we've already gone over.
So all the symptoms you're saying are all executive functions. As you can see, like on this questionnaire form we filled out, these are all those types of patterns and function.
Yeah.
So, when you actually start to do complex motor movements and start to do cognitive tasks that are different, like when you walk, like when we examined you and you try to walk with doing math, you couldn't do it. Like you physically could not do it. You had to stop and you're like, I just can't do this task. That is a task. As you do it and do it, you're going to build these frontal pathways, because you're not going to get in a debate and argument and do those things all the time. And as you get your brain inflammation down, as you get your autophagy happening, you're going to see some change there. And remember, everything we're doing here is to fix your gut. We're going to fix your brain to fix your gut, but we want to keep a focus on these symptoms. So we're tracking your symptoms that relate to your concerns every single time we talk in a month with this form. And these all have to go down to 0 or 1 for you to not have those problems anymore.
Okay.
There's lots of different ways we can activate the frontal lobe. The exercise that I picked was just based on your exam findings. Like there's hundreds of frontal lobe exercises. But when I see you freeze and not be able to double task when you walk, that's the one I'm going to pick, because that's the one that clearly shows that's where the areas are not integrating. Right? So when I see you not be able to finger to thumb, I'm like, well, that's the one we got to activate.
Yeah.
Right? So it's very specific to you, and it's still going to activate these areas. So just hang in there. I mean, listen, you're just like entering the treatment plan. Like you just got into ketosis, and barely. Okay, and now we got to get those you got into ketosis, but you don't have this. You have just a little amount of ketones. As we get those ketones up, and as you get consistent, as you get your dopamine levels working with your frontal lobe, and as you start connecting into your motor movements and all these things happening, you're going to see actual impact from a protocol. Right now, you're just in the initial getting into it, which is the hardest part, to be honest with you. And the next hardest part will be for you to get motivated to get some dopamine levels up by movement and exercise, and then the rest is going to probably be pretty smooth in this consistency. So that's the plan, and then we'll connect again in a month. Between now and the month, please send me those emails each week, like you have set in your calendar, and then I'll have you fill out these forms again and everything. By then, we'll get that Cyrex Array 7 back. So we'll see if you have any neurological autoantibodies and see if we have to do an autoimmune component to it. But the goal right now is increase your ketones, get your dopamine levels up, keep doing your neurological exercises like we talked, and then we're playing ball. I'm ready to see some change happen.
Okay. Yeah. Sounds like a plan. Thank you.
Okay. Good talking to you, Mark.
You too, Doctor.
Okay.
I'll see you next time.
Thanks. I just wanted to make some commentary on that first appointment with Mark. So one of the things that's really important to understand is that Mark's chief complaint is really chronic gastrointestinal issues, and it was really clear to the examination that he had some brain-related injuries. But if we remember the discussion we had, his cortical pontine pathways, meaning his gag reflex, was totally fine, but he was in the sympathetic dysautonomic pattern. So the initial parts of care, he's falling through, he's into ketosis, but if you notice, he's not making much ketones. So as his ketone levels will start to go up, he should get some more anti-inflammatory effects. He just has to increase the fat in his diet. The key thing was to really make sure that he was able to get into ketosis. Now that he is in ketosis and he's into intermittent fasting, his dopamine levels have really dropped down. So, to deal with his cognitive and brain-related issues from the brain injury, there is some dependence upon THC, and THC has impacts on dopamine, serotonin, and other neurotransmitters, but his dopamine levels are really plateaued. And Mark has really done a great job learning about how the body works, and he was really quick to pick up on that. His dopamine levels were low. So with low dopamine patterns, it's really hard to motivate, to initiate, and his frontal lobe is part of the initiation as well. So we have to see what happens, but I think as he gets the ability to get some physical activity and his dopamine levels go up and he stays in ketosis, we'll start to see that frontal lobe start to change. And as he starts to use more complex motor planning behavior, we want to see that frontal lobe come back, and we want to see his executive functions in that brain region localization form change. And as he does his brain exercises and gets himself into ketosis, his inflammation goes down. As he does intermittent fasting to promote autophagy, to get rid of those prime glial cells, we're also hoping that as he does activation to his brain and exercise and movement and double tasking while he moves, that he builds mitochondria in his frontal lobe. As his mitochondria changes, we should see his endurance and energy levels of his brain change. So with those questions that were asked in the initial report is, let me know how you're doing with your energy levels, let me know how you're doing with sleep. As we get those messages back, we'll get a pretty good idea of what's happening. So what I would like to see between now and the next appointment is that he starts to notice his sleep continues to improve, as he hopefully gets the ability to get a couple workouts and get his dopamine levels and he gets into routine exercise. We should start to see his brain change. And as his brain changes, we want to see if his sympathetic pathways calm down. And as his sympathetic overactivity comes down, we want to see if his digestion starts to improve and function again. So right now he's in a constant sympathetic tone, so he's not able to produce digestive enzymes, has poor motility, has distension and bloating. So this whole pattern may take some months to go through, but we're hoping to see some initial change between now and the next appointment. So I hope that helps understand the strategy and that highlighted some of the key things that we talked about in that first follow-up consultation.